Uncertainty right now as the coronavirus continues to spread, even for those on the front lines of combating COVID-19. Our problem solver Melissa Hippolyte spoke with an ER doctor about the situation and the changes those workers are hoping for to help them treat their patients.
You know, we've always got something kind of out there.
ER Doctor Joran Sequeria has a message for employers in the Richmond region. Please stop sending your employees who recently traveled or who have a family member that might be sick or an upper respiratory issue to the emergency room for a COVID-19 test and a note from a doctor saying they can or cannot work.
We're very limited on testing, and so we truly cannot be testing those who are asymptomatic right now or those who are not very sick. I would first have them call the Virginia Department of Health because they could also be doing too much, right? So call the Virginia Department of Health. There's a hotline number. And talk to them. Does this patient really need to be self-quarantined or can they continue work as usual?
Sequeira says as it stands right now, emergency rooms are really the only place where people can get tested for the virus in Central Virginia. And mixing well or asymptomatic COVID patients with people who are gravely ill with something like pneumonia can make for a dangerous cocktail.
You could be giving that now to somebody else. Or if you could also be exposing yourself too.
On Wednesday, the state health department opened the first pop-up drive-through testing location in our area. Sequeira says we need more of them.
So ideally, we would love it if there were testing centers off campus somewhere.
To try to limit exposure, Sequeira says her hospital has divided the ER into two separate areas. People with respiratory issues go one way, everyone else goes another.
Every patient that's coming in with low oxygen levels or pneumonias or fevers, you have to think, is this COVID-19? And so is this a possible patient that we should be testing?
The initial screening dictates whether the doctors and nurses who attend to each patient wear a mask.
I think right now we would love it if we could all wear masks for every single patient, but that's just not possible. We don't have enough just simple surgical masks to wear for every single patient.
Research shows the healthcare workers on the front lines of the pandemic are at a higher risk for developing the virus. Sequeira says her hospital currently has enough protective gear, but it's very early in this battle, and they're expecting things to get worse.
We're nervous because we're fearing a little bit of the unknown. The question is, how long is that supply going to be around, right?
Are there enough beds at the hospitals in Virginia to handle this? Are there enough ventilators if people need that help to breathe?
I don't know. That's a simple answer is I don't know. If it gets really bad, I'm afraid not.
With regard to testing, the head of the Richmond and Henrico Health Department said Bon Secours is working on setting up several regional testing sites where people can go for COVID-19 testing only, but he wasn't sure when those will go up. He also said some local doctors are starting to do testing at their practices. Working for you, I'm Melissa Hippolyte for CBS 6.